So I took office in 2010 and I decided to develop a new European health policy which was very strongly supported by the regional committee. And the reason for that was twofold. First of all, Europe always had a proud tradition of having a European policy which brought the region together, and the 53 member states worked in a very uniform way to address the challenges of the region. And since then, during the last 12 years, since the last policy was adopted, there have been a number of changes in the European region and has become extremely complex, and we are dealing with a large number of very complex health issues, be it NCDs, be it the aging population, be it climate change, which go hand in hand with two other major challenges in the region. One of them is that we want to continue to increase the health outcomes, on which we have made very good progress in the region as we gained 5 years over the last 20 years, and we hope that this trend will also continue, but we have to work for that. But we have another challenge which is even bigger than this, and this is that the health inequities, health inequalities in our region have been growing over the last 30 years. In the 1970s, our region was much more homogeneous than it is now, and this is a real challenge for all of us and a real concern for us health policymakers, and this is one of my main concerns and main priorities to address it. And this was the main reason behind the fact that I suggested to the Regional Committee in 2010 to update the European policy and develop a new one, and this was fully supported by the Member States.
This was not to be a document that was to be written in a university or in a back room of a WHO department. It had to be informed by the best available evidence. So one part was the science. The other part was the engagement of a wide range of stakeholders from the start. Primarily our member states, but also through our member states with different constituencies, the public health constituency, subnational, links to cities, to NGOs. It was an effort to reach out, involve, consult as many perspectives, as many interests as possible, and create opportunities for them to be involved, to give us the feedback we needed to steer the process on a path that will create ownership and engagement.
I would like to thank to all our member states, all the ministers, the chief medical officers, all the public health experts, all the academia who have worked on this hand in hand with WHO. And I would like to thank very specially to all the experts who have produced the evidence-based studies, because this is a policy that is not only value-based and action-oriented, but also evidence-based, and there has been an unprecedented review of all the existing evidence to identify the gaps and also to develop new evidence.